For everyone, sleep plays a key role. So how is the sleep related to ENT issues?
Sleep it is responsible not only for the physical health as well as mental health and cardiac health also. The ear is a organ which is responsible for hearing as well as balance too. Vertigo is a medical term we use for dizziness or giddiness. The exact sensation what the patient gives is, madam, the entire room is revolving around me, or I am revolving. That is, it is a spinning sensation of the moment. So the thing is, because of that the patient gets anxious, and because the patient can have frequent falls also, and because of that they will have severe vomiting sensation. The sleeplessness can play a role in vertigo, but exactly the vertigo is something complaint which is related to the inner ear. A few years back we hardly used to see the patients of vertigo, but now the number has drastically increased. It might be because of the stressful lifestyle.
Hi, do you feel dizzy? కళ్ళు తిరుగుతున్నాయా? సో కళ్ళు తిరుగుతున్నాయి, నిద్ర పట్టట్లేదు, heavy head లేదా nose block. What are all this? Are they all contributing to something bigger? Something dangerous? Nah, don't worry. So today it's all about hearing issues, and that too we have Dr. Vennela on my Med Talk with Mona at Omega Hospitals, Gachipoli. So I understand, considering the season, especially in the winters and rainies, we come across a lot of hearing issues which are contributing to many other issues. If not, many other issues like dizziness, sleep disorders, heavy head, blocked nose are somehow directly or indirectly messing up with your hearing issues. So let's have a detailed conversation about all these issues. Hi, Dr. Vennela Devarakonda.
Hello.
Myself, Dr. Mana, and I welcome you to Med Talk with Mana at Omega Hospitals, Gachipoli. So you are senior consultant ENT, head and neck surgeon at
I'm
Omega
heading
Hospitals.
the ENT department in Omega.
Wow, great. Pleasure meeting you, doctor.
Yeah.
So in today's discussion, I just want to know the basic things. First, I want to start this conversation with the basic things. For anyone to have a good day, they need to have a good sleep. So mundu night proper sleep ledante the next day is completely messed up. Considering from a baby to a school going kid or a college going young adult or anyone heading to office or whatever it is, for everyone sleep plays a key role. So how is the sleep related to ENT issues?
So, Mona, this is a very important topic to be stressed these days, because sleep is it is responsible not only for the physical health as well as mental health and cardiac health also. I am not going into the cardiac health, which is out of my subject. So let's discuss how it affects the ENT problems, like how it has impact on the ENT. See, coming to sleeplessness, the patient will have tiredness, because that is what there are different sleep disorders. The patient might have disturbed sleep mainly in the night because of any airway obstruction. It can be at the level of the nose, it can be at the level of the throat, it can be lower down, it can be at the level of the pharynx, it is at the below the vocal cords. So there are different levels of obstruction. It can be due to mental stress and anxiety, and some people have disturbed sleep. It can be because of mechanical obstruction also. This part most of the patients are unaware. They think that I'm not sleeping because I'm stressed out, I'm doing so much, I'm spending lots on mobile, all these are affecting my sleep. But there is some factors, mechanical factors, which play a key role. So like obesity, for example, if the patients are obese, so there will be bulky tissues everywhere. So bulky throat and the short necked, bulky tongue. So whenever they sleep, the tongue may fall back and the patient cannot sleep. So that is at the level of oral cavity. Coming to the nose, the patient can have deviated nasal septum. So all these things ENT surgeon only can bring awareness to the patients and can explain in detail what is exactly happening inside, why he is not able to sleep. So it needs a proper evaluation with the ENT surgeon. So once we rule out mechanical factors at the level of the nose, at the level of the throat, at the level of the pharynx, and at the level of the vocal cords, then we can definitely send the patient to other departments. So ENT surgeon's opinion is mandatory in sleep disorders. That's what I want to stress.
So when it comes to like a normal life of any human, let's say, for example, a person is like I mean like is devoid of sleep for past 2-3 days,
Okay.
and then he's no other choice rather
Yeah,
than heading
yeah,
to work,
yeah.
and then he starts feeling dizzy, and then he'll consider it as okay, 3 రోజులుగా పడుకోలేదు, నాకు అందుకే కళ్ళు తిరుగుతున్నాయి, అందుకే ఈ డిజీ ఫీలింగ్ ఉందా అని అనుకుంటారు. సో హౌ డు యూ
So
రిలేట్ దిస్?
that is called dizziness. First, I start what exactly is the dizziness. So dizziness, the synonyms are, it can be lightheadedness, it can be, it is also called vertigo. Vertigo is a medical term we use for dizziness or giddiness. The exact sensation what the patient gives is, madam, the entire room is revolving around me,
Okay.
or I am revolving. That is, it is a spinning sensation of the moment.
Okay.
So the thing is, because of that the patient gets anxious, and because the patient can have frequent falls also, and because of that they will have severe vomiting sensation. And the vertigo, the scenario of vertigo is interlinked. It is not because of sleeplessness, or it is not because of see, the sleeplessness can play a role in vertigo, but exactly the vertigo is something complaint which is related to the inner ear pathology. So the inner ear, the ear is a organ which is responsible for hearing as well as balance too.
Okay.
So we need to rule out ear pathology. So what exactly is happening inside the ear? So some patients have continuous exposure to loud noise or continuous exposure to audio devices. So all these can have impact on the hearing. So when the nerves of the ear or gets weak or gets weakened, or when there are in the inner ear there are exactly 3 semicircular canals. There are some calcium crystals and fluid inside this 3 semicircular canals which are responsible for the balance. So any alteration in this physiology or dynamics of equilibrium, then the patient can have vertigo. So this is what exactly the pathology behind the vertigo. So this is called peripheral vertigo. There is central vertigo as well, where the neurologist has to pay attention on it. So in this central vertigo, what we see is what exactly is happening in the brain, whether this equilibrium pathway is linked to the brain properly or not. Is there any disturbed because of any other diseases? That is central vertigo. So but most of the 90% of the cases we see today is because of peripheral vertigo, and the commonest vertigo is called benign paroxysmal positional vertigo. That is the 90% of the cases. So it can be, there are other factors because of the lifestyle, busy lifestyle, like cervical spine factors, continuous car driving, or sitting, software people, they sit at one place facing the laptops. All these can cause the weakened cervical muscles. It can cause vertigo. And migraine. Migraine is the culprit behind the vertigo as well. It can cause giddiness, it can cause aura, it can cause severe headache, and even insomnia. As you mentioned, disturbed sleep can cause vertigo. But disturbed sleep can cause vertigo. It is a short-term vertigo. But this benign paroxysmal positional vertigo is a severe, it can cause severe vertigo. Patient can land in hospital also with severe vomitings and all. So all these things are there. So vertigo can impair the quality of life. So instead of suffering so much, it's better to take the opinion of ENT physician or surgeon, because it is a treatable condition. So it is a treatable disease.
The prime culprit behind all the spinning is nothing but the ear.
Ear.
Starting from the ear.
Ear, and we need to evaluate the central nervous system as well.
Yeah.
So all the systems play a role. like depending on the history is mandatory.
Yeah.
So, and that's why the patient cannot take their self medication. See, most of the patients, they go and take some Vertin and all on their own, and they will stop on their own. That is not the treatment protocol. The patient has to be on long term follow up with the ENT physician as well.
Are there any limitations, like, I mean to say, are there any age limitations considering this vertigo? I mean, like more in
No,
adults or like.
actually, we before we used to see in adult population. Now, pediatric age group is also, we are seeing few cases presenting with benign paroxysmal positional vertigo because of the stress in schools or because of the migraine headaches.
So can we blame this on the screen time?
Yeah, screen time. Yeah, screen time is really, it's playing a great key role in this vertigo, because vertigo patients have drastically increased.
Okay.
Yeah, before, like a few years back, we hardly used to see the patients of vertigo, but now the number has drastically increased. It might be because of the stressful lifestyle.
So, I mean, like putting all this conversation a bit aside for a while, most of the people consider that ఎక్కువ ఆడవాళ్ళకే కళ్ళు తిరుగుతాయి, మగవాళ్ళకి
No,
అంతగా
it is not like
తిరగబోదు.
that. See, what ఆడవాళ్ళకే కళ్ళు తిరుగుతాయి అంటే, ఆడవాళ్ళకి, see, mainly Indian housewives, Indian scenarios, most of the Indian housewives have nutritional deficiencies because they don't take care of their proper diet and all. So, but nowadays the lifestyle has changed. Everybody has awareness on their health because social media is playing a vital role in all this,
So,
educating the patients.
I can drop
But
my statement under a myth. But vertigo, I mean, this vertigo plays any role based on the gender, like more in females
no,
rather
actually
than
it
in
is not
males?
like that. But females, mostly we need to rule out anemia. Anemia is
Okay.
one. See, anemia, I don't say directly anemia can cause vertigo. Anemia can cause weakness and all, and so patient can have giddiness because of anemia. It is not, it should not be termed as vertigo.
Okay.
It is giddiness, unsteadiness. There are different terms. So,
So,
depending on the condition, we need to clinically evaluate the patient, whatever it is. So, mainly in the Indian woman or Indian housewives, nutritional deficiency, anemia is most common. So, and some people can have postural hypotension too. They cannot stand for a long time. On standing
Okay.
for a long time, they feel giddy.
Yeah,
So
the
that
blood
is
pooling.
hypoglycemia can cause vertigo. Hypoglycemic episodes can cause vertigo. So there are different scenarios we need to know. So all these things, so ENT surgeon is can give awareness to the patient regarding these. So main thing is not to get panic whenever the patient suffers from vertigo. So better they have to catch hold of something. Then they should not walk alone, or they should not drive. So, and they should limit their screen time. So maintain the proper healthy lifestyle, proper meal timings. So many lifestyle modifications can help to decrease this disease.
Like considering all the spinnings or giddiness or all together, not all the spinnings are vertigo.
Not all spinnings are vertigo.
So you
Yeah.
need to like consult your right ENT specialist
ENT
to
yeah.
conclude like what sort of
What
vertigo
sort
it
of
is. Yeah.
vertigo? Yeah.
All right. So coming to the treatment part, how treatable it is?
It is treatable once you know the diagnosis.
Okay.
So the thing is like first in diagnosing this disease, the investigations before the investigation, history plays a major role. So we need to extract the proper history from the patient. So how often he gets vertigo, how many episodes per day, like how long he is suffering from, is he on any medications before, or has he stopped now, is he on irregular medications, because most of the patients can get residual dizziness also. So they don't follow the doctor, so they can land up in residual dizziness, and they will feel oh, this doctor is not treating us properly, I'm suffering since long time. But the thing is, it is not like vertigo, just you made the diagnosis of vertigo and you just prescribe the medications and your job is done. It is not like that. You need to follow up the patient, and there is some therapy called rehabilitation therapy as well. We assign some many words, Like we perform some maneuvers in the hospital, and we advise some vestibular rehabilitation exercises to the patient as well, and the eye exercises, positional exercises. They need to spend at least half an hour per day, and they need to concentrate on that. It's not like lifelong medications. We don't prescribe for vertigo. Though we start the medication, we need to taper after some time. The exact period when to taper, that the patients need to be on follow up with the doctors.
So this vertigo is not a medical condition, so it falls under a disease category.
It is a diseased category. Of course, if it impairs the quality of life, it is considered as a diseased category, and the patient cannot. It is not a self-treated condition. It cannot be. We need to approach the doctor, and we need to take the medical advice.
So are there any conditions or like cases which you've come across so far in your practice which ended up with surgical management of vertigo?
Surgical management of vertigo is like refractory vertigo. So, refractory, coming to acute Meniere's disease and all. So, acute Meniere's disease also, we used to, there is a surgical management advocated as well, but we go for surgical management as a final option. That is called chemical labyrinthectomy, something we need to do. If it is, though the patient is suffering from the chronic Meniere's disease, and though we have tried all kinds of medications, intravenous, oral, everything, and if it is not subsiding, and the patient is not able to sit as well, severe vertigo, then we go for labyrinthectomy or endoscopic lymphatic sac decompression. All these are the final options. If the patient is not responding to any of the drugs in severe form of vertigo, then we need to compromise the hearing. See, why we don't go for surgical management in vertigo is, once we touch the ear inside, we need to compromise hearing too. So always, being an ENT surgeons, we always, our goal is to save the hearing of the patient. So mostly 90% of the cases respond to medical management, and surgical management is very less, hardly, it is very rare. The patients land up with surgery. Yeah.
So that's the most interesting part when it comes to the ENT.
Yeah.
So are there any, anyways we are in the winters now. So the most common winter issues considering the ear.
The most common, I'll tell you, starting with basic, it is itching, okay? So because in winter, most of the patients complain of dermatological
dry skin issues and
diseases and derma complaints, like dry skin and dermatitis and all that. So that affects even the skin of the external auditory canal of the ear. So ear is, the skin of the ear is very sensitive. So people have that habit of meddling the ear frequently with earbuds. So in the winter, there will be the dryness of the skin is reported even in the external auditory canal. So that can cause itching, and the frequent meddling of the ear, and the skin becomes flaky. So keratin flakes also. So there are keratin related issues in the ear, and dryness of the ear. So what I advise is to just put a Vaseline lotion on the earbud, and just once a day, just wipe the canal with that Vaseline lotion. So frequent meddling is always contraindicated.
So, but as you've mentioned about application of Vaseline using a bud, most of the people, they just go for like adding up lukewarm oil drops or something.
No. See, that oil drops, we don't know the composition, like whether that.
And there are still few families who consider like adding up this lukewarm coconut oil drops in their children's ears and all.
Oil.
Yeah, true.
We don't know how the skin responds to, because they are considered as irritants and all.
So they're absolutely
some patients
contraindicated.
land up in infections of the external auditory canal, that is called otitis externa, where we need to treat with antibiotics as well. So we never advise coconut oil or other kind of oils and all. So better it is always safe to use this Vaseline lotion.
So considering this winters, let's say when a child or an adult or any elderly person is down with flu, cold,
Oh,
blocked nose, and
okay.
they'll be in a constant urge to like meddle with their ears by like, because they can't bear that itchiness in the ear, and they're not
Yes.
sure if the block is through the nose or through the throat or through the ear.
See, ear, nose, throat are all interconnected.
Yeah.
These three systems are interconnected always. So when there is a nose pathology, it can be common cold or any other specific sinusitis, acute sinusitis, chronic sinusitis, allergic rhinitis, fungal sinusitis. There are different diseases related to the nose. So the predisposing factor in allergic rhinitis, it can be deviated nasal septum. So allergic rhinitis means it is related to immunological mechanism of the body, increased serum IgE levels and all. So deviated nasal septum can aggravate it, because deviated nasal septum can narrow the nasal cavity. Already the patient has allergic rhinitis, it can cause flared up secretions. So this deviated nasal septum is adding to that. So whenever there is a deviated nasal septum in the nose, there is one tube called eustachian tube, which is connected between the nose and the ear. So it is responsible for the ventilation of the middle ear. So whenever there is a recurrent cold or sinusitis or deviated nasal septum, this eustachian tube gets blocked. So in that case, the ear will not get ventilated. There is a problem, it impairs the ventilation of the ear. So that's where the patient land up in oral fullness or itching, because some discomfort he experiences in the ear. So then we need to evaluate the nose also. If some patients may develop the ear infections also, which is called serous otitis media, because of the impaired ventilation of the eustachian tube. This eustachian tube is one important structure which helps in the ventilation of the middle ear. 90% of the diseases of the ear is because of the impaired ventilation, because of the blockage of the eustachian tube.
But primarily when it comes to cold, let's say in Indian families, we just tend to go for like home remedies like steaming or basic first line flu medication and all,
Yeah.
right? But are there any alarming signs wherein it's like, okay, it's the time like not to rely on the home remedies and it's time to hit the ENT doctor?
Yes. See, most of the patients think that they can treat sinusitis at home. It is 90% it is self-treatable condition.
Yep.
Still, now the awareness haven't come in most of the patients.
I agree.
They just do steam inhalation. They don't want to come to ENT surgeon. So, see, steam inhalation, it offers a temporary relief. It may improve the breathing for a while, but it has drastic effects on the anatomy of the nose. If you do steam inhalation every day, during COVID time, it was contraindicated. See why means, see, like we can do steam in inhalation, like whenever we suffer from blocked nose, we can do. But it is some patients, some like normal population also, they try to do every day. It is not indicated, because that it impairs the mucociliary drainage of the nose. It impedes, it damages the cilia. So when the cilia are damaged, that mucociliary clearance gets affected. So it gets aggravated also. So that too they do with some hot water or Ayurvedic medicines and all. So you need to take home remedies too with the medical advice. That is better actually always, because we don't know the composition of the like Ayurvedic medicines and all, how the patient's body is responding to those
And even the intensity of the...
Yeah, like each patient responds in a different way.
True.
To these what you call herbal
remedies.
forms or remedies and
Yeah.
all. Yeah.
So apart from all this, let's consider healthy individual. What are the major portion of incidents or conditions or situations wherein that healthy individual can end up with impaired hearing or complete hearing loss?
See, healthy, it's not like healthy individual can end up in total loss of hearing or complete loss of hearing. Coming to, I will just categorize it.
The reason why
So,
I'm posing this question is because there are few people,
mm,
based on the literacy I can see, or based on the awareness they hold,
oh,
they have a habit of like putting pens or keychains or
oh,
whatever
yeah, I know. It is like
available stuff in
mainly in
their
the pediatric
ears.
age group. The
Yep.
parents need to focus on that because they'll end up in foreign bodies of the ear, sometimes in the perforations of the ear because they keep the sharp objects inside the
True.
ear. So it is, see, if the tympanic membrane is ruptured, the patient definitely land up in conductive hearing loss. There are two types of hearing loss: conductive hearing loss and sensory neural hearing loss. Conductive hearing loss occurs when the tympanic membrane is perforated or ruptured, which impairs with the conduction of the sound. So that disease can be treated with surgery. 100% if the perforation is it can be small, medium or large perforation. So we need to do a surgery called endoscopic tympanoplasty or endoscopic mastoidotympanoplasty if there is an infection in the bone as well. And if there is a like if there is a problem with the middle ear bones, there are very few small bones in the middle ear called malleus, incus and stapes, which are responsible for the conduction of the sound. So sometimes the congenital anomalies can be there, malleus will be absent, and sometimes this malleus incus will be eroded because of the diseases of the ear. So all these we need to evaluate. So where the healthy individual can land in total loss of hearing, it can be because of trauma to the ear, or where the ear membrane is ruptured as well, and because of this impact even the nerves also can be damaged. That is one condition. And any other viral fevers. So viral fevers, there are a few dangerous viral fevers can cause decreased hearing.
Oh.
Yeah, following viral infection, we see many patients developing the hearing loss. So there are few viral infections which can cause sudden sensory neural hearing loss. So the patient has to come to the hospital within 24 to 72 hours. Then only that condition can be treated. Otherwise, he will land up in irreversible hearing loss.
Okay.
So most of the patients don't know about this condition. Suddenly, following one flu, there are some cases where the patient lands up in total loss of hearing. We have seen. So because the patients don't have awareness to come to the doctor immediately. So that is called sudden sensory neural hearing loss. We give the intratympanic steroid treatment, or we give steroids and we admit in the hospital and we give high dose steroids with supervision, under supervision. And there is another category called hereditary hearing loss. Coming to like if there is a family history of hearing loss, so there is a chance that the next generation can get loss of hearing. So they need to evaluate. So and that the parents need to observe whether they are responding to the sounds, usually from 9 to 12 months. That is called prelingual deafness and postlingual deafness. There are two categories. Prelingual deafness is the deafness has occurred before the development of the speech.
Okay.
So the parents need to focus whether the child is responding to the sound, whether that milestone is achieved at proper age or not. It is very important because depending on that we need to decide how the patient or child has to be treated. That is prelingual deafness. Postlingual deafness is the deafness which occurs after development of the speech. Like it can be because of trauma, viral fevers or some other diseases. There are two kinds of deafness.
So when it's coming to the deafness, of course there are certain conditions which are treatable,
Yeah.
wherein we can gain the hearing sensation.
Connective hearing loss is can be improved.
Okay.
Sensory neural hearing loss is irreversible most of the
So
time.
there are, I'm like, most of them must have come across a few people having that hearing aid. So
Yes.
in what sort of situations that hearing aid is advised?
Hearing aid is advised if we prescribe the hearing aid once we do the proper audiological evaluation.
Okay.
So the patient comes to you with decreased hearing. First we need to do the clinical examination and we need to check the status of the tympanic membrane, whether there is a perforation, whether the tympanic membrane is intact. So we need to send the patient for audiometry. then we need to assess whether it is a conductive or sensory neural hearing loss, and there is a mixed hearing loss also, both conductive and sensory neural. If the conductive component can be treated, but if the patient has only sensory neural hearing loss, it cannot be treated, and we need to see the degree of hearing loss also. Mild hearing loss is like mild hearing loss means the patient need not take the hearing aid. So just we advise the patient not to go for loud noise exposure, not to keep audio devices in the ear for a long time, because most of the software people, they spend hours together by keeping the earplugs or earphones. So that is one that is called audiological hazard, what we call, because it damages the hearing. So we just advise some lifestyle modifications. Coming to moderate and sensory neural, if there is more than 40% or more than 50% of the hearing is decreased, like we need to rule out any, the patient has taken any ototoxic drugs, or the patient has developed any viral fevers, whether there is a noise exposure. Mainly we see in army personnel. So many army people will come to Omega Hospital complaining of decreased hearing. So because they face the exposure to loud noises because of the gun rifles and all. So all these we need to rule out. And if the 50% of the hearing is gone or more than 40% is gone, so we need to preserve the rest of the hearing. For that, we need to prescribe the hearing aid is mandatory, because some patients, they feel embarrassed to take the hearing aid. It is not like that. We need to preserve the hearing. So now currently we got many digital hearing aids, advanced hearing aids, which can help the patients in a better way. There are so many options, and there is another advanced ear technology called cochlear implantation.
Everything based on affordability.
Cochlear, that no, it is not about, it is about the profound hearing loss. It is not for mild moderate sensory neural. If the patient has a profound hearing loss, or the almost 90% of the hearing is lost in pediatric population, when there is a congenital deafness and all, then the ideal hearing aid could be cochlear implant. That is a cochlear implantation. Really, it gives another life to the patient.
But the sad reality is, at least when, let's say, if we consider a group of 10 people, out of 10, at least 7 will have their ear pods or earphones or whatever plugged in their ears.
Yeah, plugged in. I know.
At least 7 out of 10, no matter while working or gym or whatever it is.
Yeah, all the time.
Yeah. So, considering that group of population who are having this earplugs or earpods or wired earphones intact with them, what are the possible complications or medical conditions?
See, actually, I did studies on this, particularly the hazards of audio devices. We collected a sample of patients, and we just monitored the audiometry results before using the audio devices. After using, we noticed a significant number of patients suffered because of the noise induced trauma, mainly in the younger age group. So I have seen a few patients who lost 50% of the hearing because of these headphones, and because then, so this is the main thing, really we need to focus in the current society. Mainly the software companies, they are not paying attention to this, because many patients are suffering, because all the time they will be on the earphones, earplugs. At least, okay, if your job demands that, it is okay, but you need to take a breaks in between. And there are other conditions also, not apart from decreased hearing because of these audio devices. They can cause infections of the external auditory canal too, because sometimes the ear plugs are not sterile. They won't be clean.
Not sometimes, I can say most of the time.
Most of the times,
yeah.
Because the external auditory canal skin is sensitive. It can cause ear infection, fungal infections, because there is no air. Will be hypoxia inside, because the ear plug is tightly fitted into the external auditory canal. There is no air or ventilation. So it can cause the bacteria can grow there. If you are stopping that, what you call that ventilation part, so then it can cause fungal infections. It can cause bacterial infections from the external auditory canal. Sometimes it can cause severe pain. It can cause redness because of the continuous occlusion of the EAC with earplugs. So, and sometimes the wax will go inside and you are pushing the wax inside and it can cause hearing problems too. There are different problems, like you will experience discomfort too apart from the hearing loss. So, so better not to use audio devices for more than an hour or half an hour per day.
I feel this is an amazing conversation about like ear, nose, and throat. But before wrapping up this med talk, I'm like a one closing question, that is the importance of earwax.
Yeah, earwax really, like it's a, the thing is many patients they believe that ear wax production is a disease. It is not a disease, it's a physiological process which is happening inside the ear. So, it is secreted by the glands present in the external trigonal, and this wax keeps migrating. There is a movement like slowly. So, usually the wax occlusion of the ear with the wax happens when there is a narrow external auditory canal. It depends on the anatomy of external auditory canal too. So, some people will have wide ears. So, they do not report any wax production or wax infiltrating the inside, they do not report. But some few patients have very narrow external auditory canal. So, these patients, the wax will be impacted inside, and sometimes like if the dry wax or flaky wax, or if the wax gets swollen with after water absorption, mainly in swimmers and all, it can cause itching sometimes. So, then some patients will have ear pain. Some patients can come with infected wax too. So, we need to treat with antibiotics also. And some patients can complain decreased hearing because of the impacted wax. What they think is, if you just wipe the ear with the earbud, the wax will come out. It is a myth. The wax will go inside when you use the earbud. So, never use earbuds when you have a doubt your ears are blocked with wax. Please come to the ENT surgeon and take his opinion, and you cannot remove the wax at your home. It will not come out. It will go inside if you meddle the ear more with earbuds.
It's like worsening the condition.
Yeah, it's worsens. Sometimes it can cause severe pain.
Yeah.
Sometimes the wax can be hard, the wax can be flaky. There is a white wax too. Like there are different like entities here we need to consider. So, that ENT surgeon knows, because we have special instruments designed according to the anatomy of the external auditory canal, and we remove with the under the guidance of endoscope, we see and remove it.
Yeah.
Yeah.
So,
even that most of the patients, they have that what you call that, they have the habit of cleaning the kids' ears with earbud.
yeah, true.
We shouldn't do that.
Either they twist the towel corners and then try, if not they use
So,
the earbuds and all.
you are just damaging the skin of the external auditory canal. Yeah. Sometimes they forcefully do it. That earbud will go inside and it can rupture the tympanic membrane also.
Yeah, it's just because lack of awareness. They just want to meddle with the anatomy.
They just want to meddle with the anatomy. Yeah, that is the thing.
All right.
And some people are scared to come to ENT doctors or ENT surgeons, but it is not so. It is
Other
a
than
simple
scared,
procedure.
most of the time
We
it's
are
all
doing the
just
painless
yeah.
removal of the wax under endoscopic guidance. Yeah, they need not get scared.
It's not like scared. It's just, I can say, a vague ignorance, if I'm not wrong.
Yeah.
Most of them are ignorant. They just want to go with the home remedies, dump some oils or do something or twist something, put something in the ear and twist, which is like.
But some drugs are prescribed for the wax softening. That they are called wax softeners. Benzalkylonium chloride with it is called with turpentine. All those like drugs, standard drugs are there available. Standard eardrops are there. But don't use garlic oil, coconut oil, whatever oils to soften the wax. Yeah, that can cause damage to the ear.
So, thank you so much, doctor, for your precious time and your valuable insights on our first line basic issues with the ear, nose, and throat. Looking forward to many.
Thank you so much for the pleasant discussion of the ENT topics.
My pleasure.
So that the patients will be benefited. Thank you so much.